Good afternoon, everyone. Uh, my topic is an anterior segment optical coherence tomography to understand clinical diversity of macular corneal dystrophy. Regarding introduction, macular corneal dystrophy is a category 1 corneal stromal dystrophy as per the International Committee for Classification of the Corneal Dystrophies classification. There is a deposition of the glycosaminoglycans in the Bowman's layer, keratocytes, extracellular matrix, and the endothelium in the central cornea that coalesces later to progressively involve the entire corneal stroma, limbus to limbus. Although majority patients with MCD in the early stages, anterior stroma is the main site for the stromal deposits and distinctly in the central cornea. But it can have discrete peripheral deposits which are distinctly located to deeper layer of the cornea. The aim was to characterize the corneal deposits of the macular corneal dystrophy and correlate with the high resolution ASOCT. 17 eyes of the 11 patients were evaluated for corneal features on slit lamp biomicroscopy, and ASOCT performed to correlate the clinical findings. The location and the level of the corneal layer involvement used as basis to characterize the deposit in the macular corneal dystrophy. All procedures performed were in accordance with ethical standard of institutional research and adhere to the tenets of the Helsinki Declaration. This is the figure of the macular stromal dystrophy involving the center and the peripheral part, and this is the OCT of that case, having showing the hyperreflectivity in the center and the peripheral cornea. This was the table where 6 eyes were having the central MCD, and the 10 cases were having the central plus peripheral MCD, and the one was with diffuse haze with spheroidal degeneration, where the center or the peripheral could not be distinguished. The mean age was 33.5 years with an equal number of male and females. In 6 patients where both eyes were included, the clinical picture was identical in the 2 eyes. The mean visual acuity was 2160. Mean pachymetry was 447 plus minus 42.5 microns with IL master, and 449 plus minus 42.9 microns using the OCT calipers tool. There was no significant difference in the pachymetry assessment with the 2 devices. The stromal deposits were restricted to the central 8 mm in 6 eyes. In the rest of the 10 eyes, the deposits were seen in the both central and the peripheral cornea. In one patient, no such distinction could be made due to diffuse nature of the deposits throughout the cornea, with a spreading of 1 to 2 mm of cornea internal to the limbus. The OCT imaging showed hyperreflectivity in the anterior stroma corresponding to the deposits in the anterior stroma with thinning of the epithelium overlying the stromal deposits. The peripheral deposits were notably seen as the hyperreflectivity in the deeper cornea at the posterior membrane level. In one patient aged 77 years with dense stromal haze, the posterior stroma was not very well characterized due to optical shadow effect from the dense anterior stromal deposits. Another patient, aged 63 years, had deposits in the deeper corneal layers, remarkably thickened descent membrane, and few anterior stromal deposits on the OCT imaging. This is a picture having a bilateral macular corneal dystrophy. MCD, the conclusion is the MCD exhibits a clinically diverse presentation as revealed on the clinical and the OCT study. MCD is an autosomal recessive dystrophy that arises because of the various mutations in the CHST6 gene. As per the clinical description of this stromal dystrophy, the deposits of macular dystrophy begin in the central corneal stroma that later spread to the periphery to reach the limbus. The description and the level of the peripheral stromal deposits are not very well characterized and have only received an incidental mention in few reports. The clinical presentation probably represents a distinct clinical presentation of macular corneal dystrophy as it is seen in many patients, even in the early ages, and therefore not necessarily a feature of progression of the dystrophy, with age from the central cornea to the peripheral cornea. Thank you.